But we're still going to go to Washington, D.C. We're happening right now. There is a press conference. I have a little bit of information. So we heard from Health Secretary Robert F. Kennedy Jr. earlier, also CMS Administrator Dr. Oz, and basically officials at a federal level discussing a breakthrough with what they're calling a breakthrough with health insurers regarding prior authorization policy. Let's take a listen in to what's being said at this moment.
My Chief of Staff, Margaret Bush, Deputy Chief of Staff, Holly Walla, and the entire HRSA team. They have put tireless efforts into this, and they have been the real leaders in this, and they are the real heroes that I really want to acknowledge and thank. At the Health Resources and Services Administration, we know that when families make that difficult decision to say yes to a donation, they are entrusting us and the national organ system with their loved one's legacy. When safety lapses occur, trust is broken. And if families lose trust, fewer will choose donation. That is simply unacceptable, and we are here to fix it. Under Secretary Kennedy's leadership, the Organ Procurement Transplantation Network modernization efforts are strengthening patient safety and restoring trust. Over the last 8 months, HRSA has led historic modernization of the organ procurement and transplantation network, transforming governance, transparency, technology, and accountability across the transplant system. First, governance and accountability. For the first time in 40 years, HRSA separated the OPTN board from its contractor and seated an independent 34-member board through a national special election with 83% voter participation, showing strong community engagement. Second, transparency and fairness. HRSA launched a public dashboard to improve transparency and increase oversight when organ allocation deviates from OPTN policy. This is called allocation out of sequence, which means patients were skipped over for their chance for a life-saving transplant. Third, policy reforms focused on safety. To strengthen both patient safety and fairness, HRSA directed the OPTN to review and change multiple key policy concerns, including the unfair allocation out of sequence procurement safety through clear policy directives. Fourth, modernizing the finances, we moved away from the model where one single contractor monopolized the system for 40 years and into a new multi-vendor environment which is best-in-class contractors. And Congress, and thank you to the members of Congress that did this, thank you for the fee changes that you made. This change is going to help HRSA bring greater transparency and oversight in how patient registration fees support the OPTN operations. Fifth, a new complaint reporting process and better data to improve patient safety. HRSA opened a direct reporting channel for misconduct and safety concerns, giving us full visibility into patient safety complaints across the system. Through this new reporting system, complaints can be reported anonymously and will allow investigations, appropriate actions to be taken. But our work does not stop there. Today, Secretary Kennedy is directing a new initiative to improve patient safety and further restore integrity to the nationwide transplant system. This new directive authorizes the OPTN Board of Directors to designate a full-time patient safety officer. This officer will be responsible for coordinating responses across clinical operational teams, ensure compliance with federal priorities, and take corrective action whenever patients are at risk. This builds on our previous directives to the OPTN requiring national reporting and safety-related concerns and stronger safeguards in organ procurement. Families and clinicians deserve a system that is trustworthy and accountable. They all deserve this. When disturbing practices came to light, Secretary Kennedy and HRSA acted, directing corrective actions, enhanced monitoring, and national reporting to restore integrity and accountability. Patients and families must know the system is fair and worthy of their trust. This is the standard we are setting today. This is the promise that Secretary Kennedy and President Trump are delivering today. And with that, I would like to turn it over to another leader in this entire area, is the Deputy Secretary of the Department of Health Services, Deputy Secretary Jim O'Neill.
What is sacred? The personal can be sacred, the eternal can be sacred, compassion can be sacred, sacrifice can be sacred. And saving the life of another by giving of yourself unites these dimensions of the sacred into one line that only points to the future. But fear can stand in the way. Living donors, even in their generosity, fear that saving another life could damage their own. And families, gathered around a hospital bed, fear that discordant incentives by procurement organizations could disrupt life-saving care for their loved one. Donating an organ is an act of great compassion, but every episode of abuse in the procurement system can frighten potential donors away. That's why today is so important. Over the past 4 years, all of us watched the public health establishment burn its public trust. All of us watched the abuses of the pandemic in dismay. But Secretary Kennedy had the solution: earn back public trust, brick by brick and stone by stone, until we rebuild the House through transparency and rigorous science. What you just heard from Secretary Kennedy and Mehmet and Marty and Tom is another story in rebuilding this House. Nearly 100,000 Americans are currently waiting for a kidney, but only 45,000 receive transplants every year. I've watched friends die waiting on the list, and I will never get over it. We have a system for handling kidney failure from transplantation to dialysis, but it obviously has limits. One limit is a compromised immune system. Cadaver kidneys typically last 10 to 15 years and require immunosuppressive drugs that present significant health challenges. By closing one wound, we open another. Dialysis, too, takes a significant toll on the body and the mind. The process can be debilitating and exhausting. Patients are tethered to a machine, and their life revolves around the machine. That is one way to live, but we can build a better one. A single kidney transplant saves Medicare more than $500,000 in dialysis. I want to talk today about 4 concrete ways the Trump administration is safely increasing the availability of kidneys for Americans in need. First, I'm pleased to announce significant investment to make living donations easier and more affordable by improving the Living Donor Program. Today, we're committing $25 million in new funding to that task. HRSA's Living Organ Donation Reimbursement Program will reduce the financial burden on living organ donors by reimbursing eligible expenses that are non-medical, such as lost wages, travel and lodging, meals, and dependent care. I started pushing this project in 2007, the last time I was at HHS, and now that I'm back, it's a true honor to announce it. Second, we're developing methods to support living kidney donation through the KidneyX Innovation Accelerator. Third, we recently broke new ground by greenlighting the first clinical trials for xenotransplantation at FDA. Soon, doctors will save patients with kidney failure by giving them genetically modified pig organs. Someday, we'll replace failing organs with biomechanical improvements. Fourth, through our investment arm, ARPA-H, we're developing bioprinting technology and regenerative medicine to 3D print personalized organs on demand that will not require immunosuppressive drugs. These 4 efforts complement our broader initiatives to enhance patient safety through the organ donation and transplantation system and bring us into a future in which waiting for a transplant will become a bizarre relic of the past. In the meantime, my colleagues and I are committed to reforming the transplant system to save and improve the lives of Americans. Previous administrations have had concerns about the OPO, but Secretary Kennedy is the first to decertify mid-cycle. Yesterday was Patient Safety Day. Today we live in the future. Thank you.
why we're here today.
I'm Dan Bernardo with the Scientific American. I'm wondering what happens in Miami now with this decertification and people waiting for transplants there. Thank you.
So there's a process by which the Miami South Florida organization can appeal the decertification. That process will take several months. They will appeal it to the Secretary of Health and Human Services. And we believe that over the next few months, they'll get a very fair hearing. If they end up failing, then there's a process to open it up to other OPO groups or new ones to enter into that region. There will be coverage. There will be seamless coverage for patients in the area. And I want to applaud the OPOs that are doing a great job, because most are. They're spectacularly effective at that tense moment of dealing with the doctor, the nurses, the family, the estranged sibling, all the things that happen at the moment of death that is sacred, as Jim O'Neill spoke to. And we want those OPOs to be celebrated. The reason we're taking aggressive action against failing OPOs is to make sure that the strong ones continue to thrive.
Thank you. Mary Margaret with Daily Wire. I was hoping you could expand a little more on some of these steps you've taken to make sure that we're not harvesting organs from living patients like so many people are concerned about.
Well, our team has done an extensive investigation in all this, and the OPTN, when they made this recommendation, this was not an easy recommendation for them to make. But now we are seeing and have done investigations in other areas. We have put corrective action in place. The OPTN board is following those corrective action plans, and they're making sure that those OPOs that are operating in those areas are going to be compliant in those areas.
Any other questions?
Hi, I'm Lauren Brensel with Politico. Can you talk a little bit more about 3D printing personalized organs on demand and how that will impact patients?
Yeah, so ARPA-H is one of our investment arms. It was created by Congress a few years ago to make non-dilutive investments in innovative technologies that will improve health. And we're using that to deploy money to figure out ways to make artificial organs that will be a better solution than donations.
Hi, Peter Wariski, Washington Post. There have been a number of allegations against some of the OPOs for double billing and other fraudulent ways of defrauding Medicare. Is there any effort to bring DOJ or any law enforcement into some of these cases?
We're aware of the allegations. Just to get everyone on the same page, OPOs are paid for the costs. They're nonprofits. They're paid for the costs incurred when they procure organs. We do have OPOs held accountable to the standards of the other OPOs. So we are investigating very seriously anything that could hurt the trust in the organ procurement system. I don't believe billing is our biggest concern, and just from what we've been seeing, but we are definitely investigating it.
Thank you, everyone.
If I could ask Dr. Lynch and Suma come up, and members of Congress, Jason, John, coming up, just get a foot. The hard work of Dr. Lynch and Suma should be acknowledged. Jim mentioned them, but they have really been leaders in the field with Tom Engels. Thank you.
No, we can't.
Get in front. Let's get in front of this. John, come over here and bounce it out. Make sure you look at that big camera in the back. Does Dr. Lynch look happy over there? Tough man to get a tough man to
All right, so that press conference looks like it's just wrapped up. U.S. Health leaders, that's Robert F. Kennedy Jr., Health Secretary, leaving the stage. Also, Dr. Oz spoke at this press conference. So we want to step away for 2 minutes. I promise just 2 minutes here on Live Impact News. We'll be back again in 2 minutes here on Live Impact News on WCNC Plus.